In this procedure, you will learn how to calculate and prepare a liquid and solid medication dose and to administer medications to a patient. Select the right medications from the storage area. Check each medication label against the order. Check for the right name, form, and route. Check the expiration date to make sure the drug is not expired. Using the drug reference information and the provider's order, review the information on the medications. The provider's order does not specify the number of tablets or the amount of liquid to give the patient. You will need to calculate the amount using the order and the medication labels. Check your answer with a peer in the workplace before preparing the medication. Wash your hands or use hand sanitizer. Assemble the supplies required to prepare the medications. Using a marker, write the medication name and dose on the appropriate cups, making sure not to write over the measurement markings on the plastic cup. You can also indicate on the cup if any assessments are needed. Perform the second medication check. Check each medication label against the order. Check for the right name, form, and route. For the solid medication, remove the cover and hold the cover so that the inside is facing up. Carefully pour the correct number of tablets into the cover. If you pour too many into the cover, pour them back into the bottle. When you have the correct number of tablets, pour the tablets from cover into the cup. Once you pour the tablets into the cup, the tablets are no longer sterile and cannot be put back into the container. Place the cover on the container, making sure not to contaminate inside the container or the cover. For liquid medication, place the plastic medication cup on an even surface. Remove the cover of the medication bottle and place the cover on the counter, making sure the inside is facing up. Put your palm over the label of the bottle. Position yourself so you are eye level with the medication cup. Read the amount you're pouring at eye level to ensure the accuracy of the measurement. Pour the medication into the cup until the lowest point of the meniscus, the center of the liquid, is at the correct measurement needed. Replace the cover on the bottle without contaminating the inside of the cover or bottle. If you pour too much medication into the cup, flush the extra down the sink. Extra medication in the cup cannot be poured back into the sterile medication bottle. Perform the third label check. Check each medication label against the order. Check for the right name, form, and route. Verify the amounts of medication in the cups are correct with the order. Place medication cups on the tray. Then clean up the area. Before entering the exam room, knock and wait a moment. Greet the patient and identify yourself.
Hello, Jeff. How you doing?
Great.
Good. My name is Tori. I'm Dr. Smith's medical assistant. Okay, I'm going to go ahead and place this down, and then I'll come over and ask a few questions.
Verify the patient's identity with his full name and date of birth. Make sure the patient's information matches the order and the record.
All right, Jeff. Can you tell me your full name
Jeff Leanhouse.
and your date of birth?
Ask the patient if he has any allergies.
Do you have any known allergies?
No.
Are you allergic to any antibiotics?
No.
Provide the right education to the patient. Explain the medication ordered, provider ordering the medication, the desired effect, and common side effects.
Dr. Smith has ordered some medication for you to take. He wants you to take cephalexin, which is an antibiotic. It sometimes causes diarrhea, abdominal pain, and nausea. And then he also wants you to take a hypertension medication, which is lisinopril. And that usually cause about the same side effects and possibly lightheaded and headaches.
Answer any questions the patient may have using language the patient can understand.
Do you have any questions?
Will I be able to drive after?
Yes, you will. Okay. Would you like to take your pills with water?
Sure.
If the patient can have water with the medication, have water available. If the patient refuses the medication, respectfully ask the patient the reason and notify the provider. Perform the right technique. Do any assessments required prior to giving the medication. Allow the patient to take the solid medication in his hand or using the cup. Stay with the patient until the medication has been taken. Document the procedure in the patient's health record. Include any assessments done, patient allergies, teaching or instructions provided, the provider ordering the medication name, dose, and route, and how the patient tolerated the medication. For vaccines and controlled substances, add the lot number, expiration date, and the manufacturer number.